Hello, everyone, and welcome back to my weekly presentations. This week, I will start a new playlist, which is about the soft skills required by physicians. Honestly, they are required by everyone, but since the focus of this channel is on physicians, I will start with the most important soft skills required, which is emotional intelligence, also known as EQ or EI. So let's get started. Intelligence in general is the ability to navigate things, whether problems, quizzes, riddles, anything, and the ability to learn and understand and then use the knowledge we have learned to solve these problems and make decisions. This is, in general, how we define intelligence, right? So, on the other hand, emotional intelligence involves the ability to understand and manage our own emotions and recognize the responses of our emotions to others. At the same time, it includes understanding the emotions of other people around us and how to act and react to those emotions. This is basically what is emotional intelligence. So it has two parts: part of understanding our own emotions and part of understanding other people's emotions and how we react to that. So this concept had been around since the 1990s, so it's around over 3 decades right now. And emotional intelligence is crucial for practicing physicians. Why? Because while taking care of patients and different patients in each single day, they need to manage and process many feelings like anxiety, stress, anger, sometimes even madness. They need to manage and process all these feelings and be able to make professional decision making in the situation. That's why it's very important to understand and know how to manage all of that while trying to be professional and make the good decision making required at the moment. So it might be easy to say that. It's not always easy to do that and practice it every single time with every single encounter with a patient. So it's really an important topic. The researchers who first studied emotional intelligence tried to explain whether it's a trait that we are born with or it's a behavior and skill that increases with time and training. And the good news is that emotional intelligence is not an inborn talent, it's rather a result of education and training. So it's supposed to be taught from an early age, both by the parents in the family context and by educators in the official educational systems, because it's really important for everyone. So if we want to compare emotional intelligence, the EQ, to the mental intelligence, IQ, I think most of us know that the IQ measures your cognitive and intellectual skills, while the emotional intelligence is about emotional abilities and social skills. So the EQ doesn't necessarily go with the IQ, because you might have a very high IQ but have at the same time a very low EQ. So they are different, but for physicians, they are both required. Moreover, some researchers started talking about considering the EQ testing for admission to medical schools. So that's one of the like the evidence prove that how important is the EQ to physicians. So this is actually the research that discussed that. You can find it in my reference slide and you can go and double check and read more about this. Now, let's discuss the main domains of emotional intelligence and the abilities required by physicians to communicate efficiently with patients and co-workers. So as we see here in the slide, we have 5 pillars. And the first step for physicians to develop a good emotional intelligence is self-awareness. Why? Because daily you operate hundreds of emotions and feelings, and you need that self awareness to control your emotions and reactions. And that self awareness help you to understand the situation. So the understanding part is important in emotional intelligence. So after understanding that, you mindfully regulate your interactions and reactions to the situations by developing several coping strategies to stress management and anxiety control and all of those emotions that we encounter daily during our practice. So we want to control all of that so that will not impact our decision making, right? This is the most important area where you link the reaction to the emotions that you feel and encounter at the moment and try to make mindful decision making away from the influence of those variable emotions. So to collaborate all the social skills that include active listening, how to practice conflict resolution. But I think most importantly is the empathy piece, which stands at the heart of these pillars because most of these emotions are driven by attitudes or behaviors done by patients. So we have to empathize with patient and understand that we deal with those individuals in their weakest point in life while being sick or whether they are in the hospital for themselves or for their loved ones. So in general, they will be under influence of a lot of emotions. And you, as a physician, standing in the strong point, being the one who's supposed to control all of that, manage all of that, and incorporate your knowledge and skills to take that patient out of that status, including those emotions and feeling taken out to your face. And it's not easy, as I said earlier, it's easy said than done to manage your feelings in response to all of that because you are also a human being. So you need to be understanding at each single moment that I need to have that awareness of the situation. And I have to make that separation between my feelings as an individual, react spontaneously to that anger, maybe from patients, to that attitude from patient. I have to have that skill of separation between my personal feeling to be professional at the moment. So one of the keys is not to take every single thing personally, because at the moment it is not personally. The patient talking to you and reacting to you as a representative of the system, the health system. You are the person in front of the patient. So whatever anger they have, whatever upset they have, they take it out on your face. So that understanding and awareness every time will help you develop those skills required to make the mindful decision making without being under influence of your own emotions. And that's the trick, is to how to reach that point and ability to be in control of all of that at the moment. And it's not easy, but it's something that we can learn and practice and improve. So here we have one of the studies that was conducted by interviewing academic internal medicine department chairs from many health systems to ask them about what they think might affect the physician's performance. And guess what? The conclusion of that qualitative study found that the professional success and failure of physicians is greatly associated with their emotional intelligence. So they label it as the most important competency that's associated with success, and lacking that EQ being one of the most closely factors associated with performance shortfalls. So building your emotional intelligence skills will help you perform better and help your patient get better outcomes. That's why it's strongly recommended to focus in improving your emotional intelligence skills so that you are able to incorporate all of that in your practice and improve your performance every single day. Another aspect is professionalism and how it is associated with the emotional intelligence. So, professionalism per se is a complex concept that includes the cognitive skills and the knowledge, and with that, there is affective component to it. So it's how you practice your cognitive skills and the knowledge that you have, but merge it with the affective component that's being part of you as individual. And professionalism implies holding that competency and the standards of knowledge in your specialized area and how to practice that with integrity, honesty, and all those ethical values to be able to practice in that high professionalism. And to do all of that, you need the emotional intelligence piece because the professionalism requires the knowledge, the skills, and the affection component. So this is how, for you as a physician, you need all of these skills hand by hand. You need all these components together to get the best out of your practice. I think this is an interesting topic, and a lot of literature has discussed the issue. If you are interested, I have put here some of the resources. And actually, thank you so much for watching this video, and I wish you a joyful practice and a joyful life. Thank you so much, and take care.